So this topic looks at what an individual occupational therapist can do to aid psychosocial well-being in the workplace. So burnout in occupational therapy was looked at in one paper, and they found that symptoms of burnout affects many OTs. So 58% polled in the study were found to have high emotional exhaustion, 94% felt depersonalization, and 97% felt low personal accomplishment. Now, these numbers are greater than what was found for the general population. So why is this significant? Even if you don't feel these effects as an OT, chances are that you have a coworker or know someone that may be struggling with this. So what as an OT can we do individually? One area that has been identified is having supportive networks. So Young et al. Found that nurses felt that emotional exhaustion was linked to their high job demands, and this was lessened if they had support from their supervisors and coworkers. Russell found that teachers who self-reported that they had no support from supervisors felt more burnt out. Having support from supervisors was associated with more positive attitudes to work and a greater sense of accomplishment. Reassurance of their skills and ability was also related to less emotional exhaustion, and also reliable alliance. So if a teacher could identify others in their social network that they could depend on in emergency, this was also related to less job-related burnout. Gupta et al. Found that spending time with a partner or family was rated as the most important strategy to reduce burnout as an occupational therapist. Brown looked at the SAOT Workplace Psychological Health Survey and suggested that more experienced OTs report they have more engagement in their position, which is associated with less burnout. So it may be beneficial for newer and less experienced OTs to develop a mentoring relationship. Another area of interest is minimizing isolation. So Lewandowski found that a sense of isolation was predictive of frustration, which is considered the stage before burnout. They suggest that these feelings of isolation may occur from insufficient communication and unrealistic expectations, so that improving communication may help to reduce isolation. In addition, Schlitt et al. Found that teachers had reduced feelings of isolation when they were given effective mentoring, when they were helped with job tasks, as well as when they were given encouragement, empathy, and provided with role models. Collegiality was also indicated as being important. This is the relationship between coworkers, and this was found to be a key factor in reducing isolation. Cooley and Jovanov suggest that you can decrease coworker isolation and consequently burnout by building relationships between coworkers. You could do this potentially by creating opportunities for collaboration, such as including work-related problem solving and a constructive discussion between coworkers. Gupta found in a self-report of OTs that being able to discuss workplace frustrations and get support from coworkers was an important coping strategy. Another area identified as being important was making stigma avert. So Scott recommends that managers in a workplace should be acquainted with mental health, and they should promote a culture that workers can discuss their mental health and concerns openly and freely. The Canadian Mental Health Association suggests that an organization may need to address stigma and discrimination first before workers feel comfortable enough to discuss their mental health and to make changes. So for example, a workplace could educate their workers on appropriate languages to use, such as people first language, and emphasize a worker's abilities. Stigma education programs have been brought up as potentially being able to help with psychosocial well-being in the workplace. So for an example, a mental health works program. After this, supervisors were found to have less stigmatizing attitudes, and they were more accepting of workers with mental health issues. Being able to self-assess and reflect has been identified as helping psychosocial well-being. So Gupta et al. Found that OTs who had a high degree of emotional exhaustion were not using self-awareness and monitoring. Also, they self-reported that self-awareness was important to reduce burnout. Archies found that self-reflecting on the relationship with the organization, themselves, colleagues, the community, and their personal relationships can help to increase empowerment and feeling prepared to deal with negative work conditions, as well as decreasing isolation. Jackson, Furtko, and Edinburgh suggest that resiliency can be supported and a professional can be better able to cope with workplace stress if they self-reflect and use reflective learning. The last area of interest is being able to advocate. So, Fernet, Guay, and Senecal suggest that a workplace should allow staff to have job control. They found that being able to make decisions in their job position and having some control over your work was found to have a moderating effect on stressful job demands, and this can help to reduce exhaustion and increase feelings of accomplishment. Lewandowski suggests that supervisors could prompt their staff to discuss improvements, including working conditions and how to improve services, and this could decrease workplace frustration. For example, a health professional may feel less frustration when they feel supported by the organization to have enough time working with their clients. In another paper by Lewandowski, they suggest that role ambiguity can contribute to workplace burnout, so that with positions, role clarification should be important. Russell and Samuelson suggest that lack of time and resource can contribute to work stress. So potentially being able to advocate this information to a workplace could help to aid their workers' psychosocial well-being.